But it also shared with us ongoing concerns. When it comes to HIV/AIDS in Uganda, there are a number of ongoing concerns. One of the concerns is that the comprehensive HIV knowledge among young people is still not high. We are talking about 56% of young women in Uganda acquiring or having comprehensive HIV knowledge. 56%. Compared to 54% of young men in Uganda having the right comprehensive HIV knowledge. We still have a big gap, we still have a long way to go, and that's why I'm happy we have this meeting here today. It's also a concern because there is still, I would say, a situation that isn't changing with regard to teenage pregnancies and teenage childbearing in Uganda. If you recall, in 2011, the DHS survey at that time showed that 24% of young women in the age group 15 to 19 years have already experienced pregnancy. The DHS of 2016 showed a 1% increase from 24% to 25%. That means a quarter of teenage girls in the age group 15 to 19 years in Uganda have experienced pregnancy. The DHS report that was launched yesterday showed that we haven't improved very much. In fact, we are back to the situation of 2011. Still 24% of teenage girls who are in the age group 15 to 19 are experiencing or continuing to experience pregnancies and childbearing. This is quite alarming. And for those of you probably who have not been following the situation in Uganda with teenage pregnancies, the situation worsened quite a lot during the COVID lockdown. According to a study done by UNFPA, based on the health facility kind of statistics, there was more than 1,000 teenage girls who were becoming pregnant every day in Uganda during the COVID lockdown. More than 1,000. On average, there were more than 32,000 teenage girls who were becoming pregnant. Why am I mentioning this? Because it relates to HIV. All of these pregnancies are unwanted. All of these pregnancies have resulted from unsafe sex. When you have more than one teenage girls becoming pregnant every day as a result of unsafe sex, we have to worry about the spread of HIV/AIDS. And that's why this meeting is really important. It's about expanding, advancing choices for women, especially young women, with regard to how they can prevent themselves against HIV. And that's where my commitment comes. As UNICEF, we will work with you to disseminate information about all the possible options and choices for young women to protect themselves from HIV. That's a commitment we will make. And the second commitment, through our procurement service, which has been important and continue to be very important, we are the agency that brings all the vaccines in the country, brings the cold chain system into the country. All the COVID vaccines that came, almost all of them came through UNICEF. to Uganda. Our commitment is to dedicate our procurement services and capacity in Uganda to work with all of you, with the government, with the donors, to expand the range of options and choices available for young women in Uganda to prevent themselves from HIV. So that's the second commitment.